6 episodes ago, I told you about my friend Preston Phillips, and I told you that the gap between the law America passed and the law America should have passed was the gap that killed him. In the 4 episodes after his, I told you about other doctors and other clinic workers who were killed in the same gap. Todd Graham in Indiana, Lindsay Overbay in Minnesota, Benjamin Mock in Tennessee, the wounded survivors in Nevada and Montana, and the thousands of clinicians who have been threatened by their own patients. In the course of the workday, they did not ask for danger. This is the episode in which I tell you what to do about it. For 20 years, America was poisoned by the overprescription of opioids. Hundreds of thousands of Americans died. The medical profession bears some responsibility. The pharmaceutical industry bears more. The regulators bear a piece of it too. In 2016, the CDC issued the prescribing guidelines that finally moved the country in the other direction. Shorter prescriptions, lower doses, avoid opioids for chronic pain, use non-opioid alternatives. The guidelines were not perfect, but they were necessary. And then, we never built the other side of the bridge. We told doctors to do something different. We did not give them the tools to do it. We have to do both at the same time. You cannot tell a pain physician in rural Indiana to use alternatives if they are not reimbursed. The patient cannot afford them. The clinic cannot bill for them. The state Medicaid plan does not pay. The patient goes home in pain. Every session I introduce a version of the same bill. Every session, the same things happen. The Medicaid agency, the insurance industry, and the pharmacy lobby tell me they are happy with current law. The bill dies in committee. Every session, there is no constituency for chronic pain patients. They do not march. Their absence from the building is exactly why the building cannot hear them. I have been on opioids since a car accident in 2009. I have never asked for an early refill. In 2018, my physician cut my dose in half. He told me the state board would come for him. I asked what I was supposed to do. He told me to drink more water and try yoga. I am not Michael Louis. I am a 53-year-old woman, and I have spent the past 7 years in a level of pain policy forgot. I see them both. The patients who have been overprescribed and are in withdrawal, on the verge of overdose. And I see the patients who have been abandoned by the system with nowhere else to put them. Both of those patients, when I see them, are the same kind of broken. They have been broken by the same gap. Principle 1, mandated escalation pathways. When a patient calls with uncontrolled pain, those calls must be routed to a pain team. Not absorbed indefinitely, a pathway, written into law, funded. Principle 2, funded non-opioid alternatives. Any state that restricts prescribing must concurrently fund alternatives. Until those alternatives are actually paid for, prescribe less is not pain policy, it is abandonment. Principle 3, embedded behavioral health screening. Unrelieved pain and psychiatric distress are tightly linked. We need a real referral pathway, a name, a number, and an appointment the patient can keep. Principle 4, clinic-level threat assessment. Hospitals must demonstrate active threat assessment programs. The warning signs in Tulsa, Buffalo, Collierville, Mishawaka, those signs must trigger a response, not a folder. Somebody is going to tell you these 4 principles cost too much, that the state cannot afford them. That escalation pathways are red tape, and threat assessment is mission creep. Run the numbers against the cost of doing nothing. Run the numbers against a single St. Francis security review, against a single set of Alena civil settlements, against the lifetime earnings of Preston Phillips, against the lifetime earnings of Todd Graham and Lindsay Overbay. The expensive option is what we have right now. We just don't list the line item as the doctors we shot. Dr. Todd Austin Graham, Mishawaka, Indiana, July 26, 2017. Lindsay Marie Overbay, Buffalo, Minnesota, February 9, 2021. Dr. Preston Phillips, Dr. Stephanie Hewson, Amanda Glenn, William Love, Tulsa, Oklahoma, June 1, 2022. Dr. Benjamin Mock, Collierville, Tennessee, July 11, 2023. They were not killed by bad people having bad days. They were killed by a country that wrote half a law and called it finished. The other half is still waiting to be written. That is on us. Call your state representative. Ask the 4 questions. Refuse to be told the alternatives are unaffordable. Be the Constituency. Learn more about Dr. Mark Ibsen and other pain management physicians who have been railroaded by bad policy on unbedsidemanners.com.